In the heart of our community, there's a rhythm, a steady beat of care, compassion, and commitment. This is The Pulse, where healthcare isn't just a service, it's a connection. Here in the Coachella Valley, Desert Oasis Healthcare has become more than a place people go when they need care. For many, it's a team, a guide, a relationship, a source of comfort when life becomes uncertain.
The Desert Oasis is knocking it out of the park in so many areas.
I thank him to this day for saving my life.
Today on The Pulse, we meet patients, members, nurses, and care team voices who share what it really feels like when healthcare becomes personal.
I know at least a dozen people here on a first-name basis. And when I need to reach them, I can pick up and dial their extension, and I get them. And when I need something special, I get that. And that's what makes me feel special.
Michael Toya is a longtime Desert Oasis Healthcare member who retired to the desert more than 2 decades ago. And like a lot of people choosing a healthcare plan, Michael had a very important question to answer. Should he choose the flexibility of a PPO or the coordination and support of an HMO?
Should we stay with an HMO or should we go to a PPO? So I consulted with our family doctor that we had found out here. And she said, I'll tell you what I told my dad. She said, you can go out and get a PPO, but then you're going to be responsible for finding who you need to see, when you need to see them, and are they the right people. Or you can think of me as your quarterback. And when you need a doctor or a service, let me help you find them, let me do the referrals. And it made sense then, and it still makes sense now. So I've been real happy with the Desert Oasis setup. When I tell people about Desert Oasis, I try to quantify what the footprint they have out here. It's gigantic. I tell people it seems like I'm driving to the Pentagon. I mean, it's so big here, all of these buildings. And they have most of the on-site resources that you could ever need. But as I said, when I go to my doctor, if I need a referral that's not in their wheelhouse, it's no issue. She said, you need a referral to this guy or that guy, orthopedic specialist, pulmonary. Boom, boom, it's done. And within a couple of days, I'm seeing the guy she thinks I ought to see. You realize real quick that all HMOs aren't created equal. The wrong HMO could probably make it a very ugly experience.
That relationship became even more important when Michael faced one of the most frightening moments of his life.
2 years ago, last January, it was a Sunday morning. We had breakfast, it was around 10 o'clock, and I felt congestion in my chest. We've all seen countless documentaries on what a heart attack feels like. Mine didn't feel like any of that. I didn't have pain in the chest. I didn't have burning in my arm, nothing in my back. I felt like I had something stuck in not in my throat, but respiratory.
What started as a feeling in his chest didn't seem like the classic signs of a heart attack, but within hours it became a life-changing emergency.
About 4 or 5 hours later, which I probably shouldn't have waited, and it was a Sunday and it was in the winter, so it gets dark early, I said to Mary Ann, I don't think I want to go to bed feeling like this, so let's just go over to Eisenhower, it's the closest place. For all the bad stories you hear about emergency rooms, I promise you, if you walk into Eisenhower and say the 2 words, heart attack, man, you go to the top of the list. And so within 10 minutes, I was on a table with a team of people over me, and they put a stent in. It turned out to be the major artery bringing blood into the heart, and the assistant kept saying, you're a lucky guy. Boy, are you a lucky guy. So finally, when it was all done, I said, well, why did you keep telling me I'm a lucky guy? I'm on an operating table having a stent put in my heart. He said, because 9 out of 10 people that have what you have die. It's called a widowmaker. And we were successful with you. So I guess I was a lucky guy that day, but that was my thing.
After Michael left the hospital, Desert Oasis Healthcare helped him take the next step in his recovery by placing him in a cardiac rehab program. And there, he did more than just rebuild his strength. He built a relationship with the nurse practitioner, guiding him through recovery, and once again, felt the personal touch that made his care team less like a system and more like a family.
More importantly, I think, I got out of there, and the first thing Desert Oasis did is they put me into a cardio rehab program, because I came through that surgery, fortunately alive, but with a lot of permanent heart damage. So the main test they do for a heart functioning is called a ejection fraction. It's basically every time your heart squeezes, how well does it pump? And a person my age, it should be at least around 50%. But I was down to 30%. And 30% is not gonna facilitate me living the lifestyle I was used to living. So they put me through a 3-month cardio program, diet, exercise, And by the end of 3 months, I was back to almost 50%. I'm within 2 or 3% of where I should be for my age. So I'm doing everything I want to do, feeling like I want to feel. And again, I thank Desert Oasis because that was not a cheap program to put me through. They assigned me to I got to pick a cardiologist. His name is Thomas Chung. He's a PA here. He's a nurse practitioner here. He's like a grandson in age to me. And I think he looks at me like a grandfather in age to him. But we fell in love with each other. And he said, I can answer most of your needs. I can look after most of your issues. And I said, well, you're the guy, but I tell you, here's the big issue when you have a heart attack. It's called anxiety. Your brain thinks of something, and you'd like to get an answer to it. But with most medical organizations, you got to pick up the phone, you got to call your doctor's office, you got to make an appointment, and maybe 2 or 3 weeks later, you're getting that anxiety-ridden answer to your question. And Thomas said, take out your phone, when I told him that story. And I handed him my phone. Here's my personal phone number. When you have one of those anxieties, text me. And for the last 2 years, I try not to take advantage of it, but when I text Thomas, day or night, weekend, it doesn't matter. I get an answer within 2 or 3 minutes. And that's really dedication. I've never met another medical person with that level of dedication to take a customer under his wing, because he understands the importance of people not walking around with anxieties. So there's people like that all over this organization.
For Michael, care at Desert Oasis Healthcare isn't only about responding when something goes wrong, it's also about prevention and education and helping patients stay ahead of health issues before they become emergencies.
Two of the primary aspects of healthcare are the actual care, but the other one is the preventative care. And Desert Oasis is really good about educating their patients. I've gone through specialty training in sugar management and diabetes, cardio, so I've gone through classes there, exercise, health, diet. In addition to our regular physical with our primary care, we do the Desert Oasis Wellness Program, where they test you for all the clinical, but also they put you through some of the acuity tests and make sure that your thinking's on track for your age. And so I think they do a lot of really good preventative and informative things for their patients.
DOHC's key prevention is they spot it right away. You know, if they see something that's irregular, they don't just sit on it, they address it immediately. They tell you, well, it looks like here that your cholesterol's a little bit high, so before it gets out of control, this is what we're gonna do. And then if you follow those steps, believe it or not, it works. You know, people are always saying, well, my healthcare isn't working for me. Are you doing what we're asking you to do? You know, that's the big key. It's not just on DOHC to just do their job. You as a patient also have to be willing to accept what we're telling you. 9.5 times out of 10, our patients are doing that unless they just don't want to follow whatever it is we're telling them.
Meet Ashika Prince, a medical assistant at Desert Oasis Healthcare. She understands preventative care from both sides, as a DOHC employee helping patients every single day, but then also as a member who experiences that same care personally.
I mean, I have a lot of other things, but the hypertension is the most recent. And so, like we all do, we gain a little bit of weight, we get a little bit older, you know, and that being said, for me, I had gained some weight, and I've gotten older, and so it's also hereditary, you know, and it's not excessively high, but they say with my history and my familial ties and just, you know, because I'm African American, it's going to be an issue for me. So now they've gotten it down quite a bit. They put me on a weight loss plan. They've given me medication, not excessive. And then also I see my hypertension clinical pharmacist, you know, about once a month, and she checks in with me. She makes sure that I don't need anything, or is it too much medication? Do you want to scale back? Like, she lets me give my input on it. And so right now, you know, my blood pressure has gotten down to a manageable point because DOHC does preventative medicine.
Preventative care is one of the most important pillars of Desert Oasis Healthcare. Through the Wellness Clinic and Priority Care, DOHC helps members stay ahead of health concerns, protect their independence, and live healthier lives.
Really, preventive care is just about identifying these chronic conditions that may not have been previously identified at like a primary care physician's office, or just something. Maybe the patient has not been engaged. Maybe the patient has been in the community but is not engaged with the primary care physician. We want them to come into the wellness clinic because we want to identify these issues. Are they living alone? Do they need a referral over to social services? Is there a new diagnosis that needs to be addressed? And it's really all about identifying these chronic conditions in these patients and getting them plugged into the resources that we have here at Desert Oasis Healthcare, because our goal is ultimately to keep patients well and to keep them out of the hospital. And that really is the whole goal of prevention, is keeping our patients well.
Just highlight for us, Leah, why it's so important to take care of yourself before you're sick.
Well, one of the things I think that is just important to people in general, I know that this is important to me, is just maintaining the quality of life and health as we continue to age. I know that as I age, I want to continue doing the things that I enjoy. I have family members. I want to spend time going on vacation. My husband loves to golf. And so I know that if these things are important to me, these are also going to be important to other people as well. So just really helping our patients to continue with their quality of life so that they're able to enjoy the time that they have here, that they can enjoy this beautiful weather that we have here in Palm Springs. They can enjoy their relationships, their communities, so forth and so on.
Just highlight for us, Leah, why it's so important to take care of yourself before you're sick.
Well, one of the things I think that is just important to people in general, I know that this is important to me, is just maintaining the quality of life and health as we continue to age. I know that as I age, I want to continue doing the things that I enjoy. I have family members. I want to spend time going on vacation. My husband loves to golf. And so I know that if these things are important to me, these are also going to be important to other people as well. So just really helping our patients to continue with their quality of life so that they're able to enjoy the time that they have here, that they can enjoy this beautiful weather that we have here in Palm Springs. They can enjoy their relationships, their communities.
I understand another part of the wellness clinic is helping people with life planning if they have those questions.
One of the things that is important to Desert Oasis Healthcare, and we've also implemented this into our wellness clinic, is what we call life planning. So it is, what do you want to happen? And this isn't a question about, how does someone want to die? This is about how do you want to live?
This is very special that DOHC is combining and offering to people not only medical care, but prevention, even life planning. I mean, that sounds very unique to the system.
It is very unique to the system. Years ago, I actually attended a conference, and whenever I was at this conference, and really just any conference in general where people are talking about innovative things, what we need to do next and all that sort of stuff, Desert Oasis Healthcare is generally ahead of the curve on a lot of the innovative concepts that are going on out there in healthcare. And I can tell you that we are ahead of the curve also when it comes to these life planning concepts. Not everybody does these life planning conversations or have these life planning conversations with their patients when they're well, when it is important to have these conversations with their patients. And I know that Desert Oasis Healthcare, in my opinion, has just really set the bar when it comes to that.
My name is Joe Curtis. I'm the Chief Financial Officer for Bighorn Golf Club in Palm Desert.
For Joe, Desert Oasis Healthcare wasn't a personal choice. It was a decision he helped make for more than 300 employees and their families. And when choosing care for a team that large, access, trust, and quality really matter. And Joe says DOHC delivered all three.
Why I chose Desert Oasis Healthcare for our eligible staff at the time, and still is, the only game and the best game in town. I've had extensive experience with them on a personal level with their medical providers. The feedback I get from our staff is that they're very happy with the availability of healthcare through Desert Oasis Healthcare. I make that a priority every time we renew our coverage for the 350 eligible employees at Bighorn. What stood out about the care of Desert Oasis Healthcare is, first of all, availability. It just seems like Desert Oasis Healthcare has all the medical providers are pretty much top in their field. All my providers have been terrific, and I have no complaints. I'm very blessed to have them taking care of my issues.
But Joe's trust in Desert Oasis Healthcare became even more personal when his own health was on the line. After experiencing cardiac concerns, he was told everything looked fine, but his Desert Oasis Healthcare primary care physician wasn't convinced, and that extra attention led to a discovery that changed his life.
I was going through some cardiac issues 3 years ago. I went through all the examinations, all the tests. My cardiologist said I was fine, there's nothing wrong with me. Well, I went back to my primary care physician, explained to him what I'd done and what the results were, and he checked them all online and so forth, and he says, I'm not going to accept this. So he called my cardiologist himself and said, look, we need to look at him further because I'm not accepting these results because it just looks terrible. So he insisted the cardiologist order a angiogram. Didn't take long, but the radiologist performing the procedure says, okay, I've found the problem. 20 years ago, I had open heart surgery and they had to fix a condition known as the widowmaker. The grafting that was done to cure that condition 20 years ago had completely failed and had collapsed, and that artery was 100% blocked. So if that had not been diagnosed properly and on time at the insistence of my primary, could have had a very, very serious problem. And so I'm very thankful for him. And I thank him to this day for saving my life.
After Joe says his doctor at DOHC saved his life, his story became even more personal. Because for Joe, the impact of that care didn't stop with him. It reached his family too. And when he talks about his son, you can just feel how deeply personal that experience was for him, how it changed the way he views Desert Oasis Healthcare.
It's not just me, it's my family. Back when my kids were covered under my insurance, obviously we were all Desert Oasis Healthcare at that point in time. And my son, and I don't want to get into it, but he went through some very terrible accident. Desert Oasis Healthcare, once I got him back here to the valley, they took over and restored his health. And all the providers, the neurosurgeons and the neurologists that worked with him, brought him back. Things like that happen. And I've been very fortunate that the providers that I've had have been abundant and very, very skilled.
Meet Mitchell Swirsky, a retired DOHC member who moved to Palm Springs during the pandemic. And like a lot of people starting over in a new community, one of the first decisions he had to make was where he would get his care. And for Mitchell, choosing Desert Oasis Healthcare came down to feeling supported, feeling listened to, and knowing that he'd have access to the care that he needed very close to his home.
I think when I was choosing a medical group out here, I chose it primarily from proximity from where I was living. And I'm glad I found it because everything is easily accessible. I don't need a wheelchair, but it's wheelchair accessible. And it's a little bit like a country club. There's waterways, there are beautiful palm trees, the colors are soothing, and everything you need is in one place.
A couple of years after moving to Palm Springs, Mitchell had a health issue that brought him in closer contact with DOHC. His experience gave him a clearer sense of how the system works, from the response he received to the way his doctor communicated with him the entire time.
My health has been great, thank goodness. I'm approaching 70, so having good health care is really important to me. A few years ago, I had a deep vein thrombosis and a blood clot in my leg. Well, that was the blood clot, and a pulmonary embolism. So that's got me on high alert to make sure I am close to my medical care. 2 days in the hospital, and I'm forever on blood thinners.
During what likely was such a scary time, what you've been through, what was your experience with Desert Oasis Healthcare then?
Well, everybody was real quick to make sure I was getting taken care of. In fact, when I was diagnosed, I said, let me go back in my car and go home and go to the hospital after that. And they were just insistent that I go straight to the hospital. Care has always been calming and caring. First of all, you don't want to feel like you're putting anybody out, and nobody here ever makes you feel as if you're interrupting their day. You really feel like you are a big part of their day. And it's important to me at this age to have people that don't treat me as somebody with gray hair that doesn't know what I'm doing. My doctor's amazing. She's young, she's smart, she listens to me. If she's at the computer typing away and I start talking, she stops and listens. That's really important, being heard. Everybody wants to be heard. You spend your working life making sure everyone you come across is being taken care of. And now that I'm retired, if I need to be taken care of, I want it to be easy. I can come to urgent care 12 hours a day. It's there when they need it. And if I make a phone call, there's always somebody to help.
In what way do you feel like Desert Oasis Healthcare is helping future Mitch be his healthiest self?
Well, considering the fact that I want to maintain the health I'm in now, and as I progress 5, 10, 20 years from now, I'd like to remain as mobile as I can. And they have programs available to seniors. And there are reminders from time to time. You can sign up for this, you can sign up for that. There's this seminar, that seminar. Gym memberships. So they're really focusing on making sure that I maintain my strength and I don't trip and fall and get injured.
For some members, feeling cared for also means being understood in their own language. Christina is a Spanish-speaking member, and she shared how Desert Oasis helped her during one of the most difficult seasons of her life.
Me dijeron que tenían doctores que hablan español y que tienen mucho mejor servicio, y lo he comprobado. En Desert Oasis Healthcare tienen mucho mejor servicio, me atendieron muy bien, me explicaron muchas cosas y estoy muy satisfecha. Bueno, fueron varios doctores. El doctor primero de Desert Oasis me hizo sentir muy bien. Yo acababa de perder a mi esposo y me ayudó mucho con varias cosas. Incluso hace poquito me fui a Las Vegas, se me olvidó mi insulina y alguien me dijo, habla a tu doctor y pregunta si te puede mandarla. Me dieron muy buen servicio, me mandaron mi insulina cerca de donde estaba yo y fue mucho más fácil para mí, me dio mucho gusto. Traten de hacerlo porque de veras se van a llevar una buena sorpresa. Yo he estado con varias diferentes aseguranzas y esta es la primera que me hace sentir bien y muy contenta.
Behind each patient story is a team of people helping members understand what comes next. In home health, that can mean helping someone regain the confidence to care for themselves again.
I get to work with just amazing professionals to become just really good friends as well. I get to help people and actually make difference, And in home health, it's really cool because a lot of what we do is education. Because at some point, we're going to leave the home and we need to make sure they can take care of themselves on their own.
Stephanie explains that education is a major part of the care DOHC provides. Whether patients are managing their medications, maybe they're recovering after a visit, following a treatment plan, or learning how to recognize warning signs, the goal is to help them understand their health clearly so they can make safer decisions and feel more confident in their daily lives.
Worked here for about 5 or so years now at Desert Oasis Healthcare, so you're an employee, but you also are a member, of course, as the medical group.
Yes.
Tell me about that decision to join, of course, the medical group. I know there's a lot of options out there.
Oh, there is, for sure. So when I had first started here, I knew that I needed a different primary care physician. I do have some medical issues, and my first appointment was like an hour with the doctor, and he went over everything, my meds, just absolutely everything. So, and then he ordered extra. I had more healthcare done to me in that one visit than I have in the previous 5 years.
During the time when you had some of these health cares, how has Desert Oasis Healthcare, whoever that specialist or physician has been, stepped in to really hold your hand?
I have had to, unfortunately, go to our immediate care for myself and then also for my family. And, you walk in there and you're scared. And for me, firstly, I was in incredible pain. And they're just amazing. It's almost a mini ER over there. They've handled my pain. They've educated me. I always leave with a big sheet, a big packet that says exactly what happened, what I need to do, any follow-ups I need to do. So there's never a question, whereas when I go to see some of locations and it just been to the doctor and I'll say, so what'd the doctor say? And they'll go, yeah, I don't know. And I'm like, but you were there. And they go, well, he didn't really talk much. Yeah, Desert Oasis is wonderful to be a patient and to be a nurse for. For real.
How does it help you feel seen and heard as a patient? Because the reality is, even somebody I'm sure in the medical world, it's confusing. It can be intimidating, knowing your options, understanding all the different health plans, whatever it is.
Yeah.
In what way does Desert Oasis make you understand it all?
Well, so I know that there's never just like one department looking at something. There's so many different teams. So I know, like, for instance, when I went to the immediate care, I know that there's a group of people that reviewed my record the very next day. And so I got a bunch of phone calls based on that, saying, you have to go over here. You have to go and see this doctor. You need to go and see this one. This one's really important. So it's really nice knowing that even though, I mean, every once in a while, I want to be a non-compliant patient. Okay? I don't want to deal with it. I know what happens when you go to the hospital. I want to do it. So having someone there going, you need to be, yeah, it's wonderful. And I know that they're doing that for my patients as well. So it's somebody else on my team who's making sure that my patients are staying healthy.
Stephanie and Ashika both see Desert Oasis Healthcare from the inside as employees and from the patient side as members. And for them, DOHC's commitment to care starts with its own team. They describe a workplace where employees feel supported, heard, valued, which shapes the way they show up for people every single day.
I have been saying this since I started here. This is the only company that I've ever worked for that truly, really, really cares about their employees. Everybody says they love their employees. These people show it.
DOHC wins multiple awards every year.
Absolutely.
The best workplace.
Yeah,
Yes.
you can't do that unless you're actually putting in work, and that's absolutely what I see.
You know, I've been places where we couldn't get a free donut, on a Friday, and here, they make sure that we have activities, our little 45-year anniversary shirt that I love to wear. They're always doing stuff to let us know that they're thinking about us.
DOHC is more than a healthcare system. It's part of the heart of this community. And for 45 years, Desert Oasis Healthcare has cared for patients through some of the most vulnerable parts of life. But that care doesn't stop at the clinic door. It goes well into the community through support for local nonprofits, outreach programs, education, and partnerships that help people throughout the Coachella Valley live healthier, fuller lives. Because real care isn't just treating an illness, right? It's showing up for all people all the time, helping families feel supported, strengthening the community we share. And for the people we met in this episode, Desert Oasis Healthcare is more than a provider. It's a trusted partner, a source of comfort, an important part of the pulse of the Coachella Valley. Thank you again.
My pleasure.
Thank you.
Thank you so much for coming to share your story.
Well, like I said, I feel an obligation to you people because you've literally kept me alive. So when you said Ron's name, there's no saying no to Ron because he's been there for me many times.
I feel like we're gonna need it in the future.
If anything I can do, I'm Italian, so I'm big on payback. Good and bad.
Yes.